Welcome to the second unit of this class. You really can think about this section of the course for the next couple of weeks as building on that foundational knowledge that we have been engaging with since the beginning of the semester. There's going to be a few slides here that may seem familiar to you, talking about, for instance, the difference between a hypothesis and a research question. I'm revisiting it here because this is going to be paramount that you understand the distinction because they really are informed by different outlooks concerning what a researcher is supposed to do, and also the kind of questions that we can ask as researchers. And while you're in this class, you all are researchers. You will be doing research projects later on in the semester. And a part of that, a crucial part of that, I might add, is having an understanding of where to find literature so that you can build an argument and explore other people's arguments. This is a critical skill to have when you are, for instance, writing a paper, and that you have a good understanding of where to find certain resources that may strengthen your argument. Also, of course, this can apply to the real world, being able to critically think about materials, also critically think about and explore people's opinions on certain topics and where those opinions come from and what foundational basis do they have to support their claims is another invaluable skill to have given the current climate, of course. So keep that in mind, and I hope you get a lot out of this discussion. So this slide has a lot of text, and you are going to see a lot of text in this presentation because really it's the best way to convey what I'm saying. Think of it as complementing what my lecture is trying to convey. Theories really inform the questions that we ask, and also how we explain our findings. A theory you can kind of think of as a way of viewing the world. At its very basis, that is what it is trying to do. There are certain assumptions that a theory has that may be founded or may be unfounded. However, they also can be operationalized to, for instance, try to address a certain need. Let's take critical feminism from this point of view as an example. Critical feminism comes from a paradigm or way of thinking about the world that says there are underlying disparities that create unequal access to certain services and shape contexts both in the social environments and also the built environments, which can negatively impact those that are most vulnerable. Taking that as an applied sort of understanding, and a critical feminist perspective can also try to address those underlying disparities that they point out. For instance, if there is an understanding that there is gender-based violence in a given community, critical feminism can explore what is the contextual reason that we may be seeing gender-based violence, and also what are some ways that we can potentially use this way of thinking and the context we learned from this perspective to address gender-based violence. Do we need to incorporate the experiences of men, get them into a focus group, and talk about, for instance, do they feel emasculated by the larger structure of their society? Is it based on gender norms that are historically based? Do we need to have a venue for women and also, for instance, other minority groups or minority perspectives to be able to voice concerns about domestic violence? There are different ways to address this, and really they need to be founded on an understanding of the local context. This is perhaps done, according to an anthropologist at least, by exploring research questions. I say questions plural because there usually is multiple when you are in a given research site. This is distinct from a hypothesis. So a hypothesis is an assumption, really. It's a claim made prior to research, which is then tested. Taking the example of gender-based violence, I can hypothesize that there is a reason that there's a high rate of gender-based violence here. I could hypothesize that gender-based violence is high because COVID-19 is increasing the amount of time couples need to be isolated together. And that isolation and extended period of time of contact may be influencing the rate of domestic violence. You can explore that as a question. Basically, it's a yes-no. Is this the cause, essentially? Giving, again, another example here that I've mentioned previously in the semester, a hypothesis concerning food banks or food stamps could be giving food stamps to poor communities in Tampa will increase access to healthy food options compared to poor communities without food stamps. Basically, you can test this hypothesis. If this hypothesis does not reflect reality, you have not proven that this is the cause. In fact, you have supported the null hypothesis. And the null hypothesis basically is there's no clear connection here that can be seen. But of course, the assumption being made here is based on economics and what is called rational actor theory. A theory, again, is a way of thinking about the world. That if someone sees a more beneficial option for them, they will take it, meaning poor communities lack access to healthy food. So if they have food stamps, they will acquire healthy food. However, that being said, food stamps do provide additional access to food goods for those that are most affected by food insecurity. However, food stamps also create other barriers, and also social stigma is attached to food stamps, which may be influencing the rate at which they are used, despite the so-called rational behavior being to use food stamps to get food, as an example. Many anthropologists, not all, but many, think that rational actor theory oversimplifies human behavior. Human behavior is messy, and we are, by our very nature, very irrational beings. We do things all the time that don't make rational sense in the sense that rational means I need to do this thing, so therefore I will do this thing. You can think of examples all the time of people doing contrary to probably what their best option is, if you want to put it in those terms. And that is because humans are not robots. They don't do things mechanistically. There is a thought process behind it. The thought process is influenced by their interactions with others and also their underlying perceptions of their needs and behaviors. Research questions try to explore that by not making any claims that are usually also very narrow, like a hypothesis. Research questions are very broad and focused generally, but you may start to refine them and get more specific as you ask additional questions. This leads basically to an interview guide of sorts. I could ask what are experiences in Tampa communities concerning barriers to nutritious food to our participant in an interview, but I'm also exploring this topic if I'm looking at food insecurity using research questions more broadly. There may be underlying factors that may be shaping people's access to food insecurity, not just their adherence to using food stamps, as an example. So that could lead to the next question: which barriers are of most concern for participants? During research, as an example, you may find that poor communities in Tampa believe the stigma they experience when using food stamps in a grocery store is a barrier to using them. If they have to, for instance, open up their purse or their bag and pull out food stamps and have to negotiate with a cashier or a grocery store clerk over, does this food stamp apply to this food good? That may, for instance, make people look at them and judge them for being poor, in a sense. That has been found in the literature as a barrier. So some ways of getting around that people have tried. So for instance, WIC, which is another program that also provides food stamp-like services and other services to primarily women, gives you basically a credit card. So you would swipe that card just like you would a credit card, and for the most part, no one would really know the difference. You of course know the difference as a person using that card, but there is less potential stigma placed on it. So you can find different ways of addressing a need if you have a better understanding of what's happening on the ground and why someone might not be doing what is considered the quote-unquote rational behavior. Again, a better review. Cultural anthropology, which really is the primary lens that we are looking at these topics in this class, likes to conduct what we call fieldwork. Basically, this is research. But to an anthropologist, research can mean many things. We like to get what's called that thick description, basically a clear understanding of all the different moving parts in a given cultural practice or context. If I'm in Belize exploring, for instance, condom use practices among men in an area with a high infectious disease burden, I may need to go to grocery stores and ask, for instance, do people buy condoms here? Why do you think people do not buy condoms here? I need to go to the pharmacist and say, do you provide prophylactics or prophylactives? Sorry, not how long are they used? Do I need to talk to men and see why don't they wear a condom, for instance, or what would benefit them or motivate them to wear a condom? Do I need to talk to women to see how condom negotiation practices happen on a given sexual encounter? You really need to have a sort of encompassing perspective when you're looking at a certain, very specific topic, ideally, for an anthropologist at least. But this doing fieldwork is complex, it's messy, because again, humans are messy, and as an anthropologist yourself, you are also a human, of course. So you have to really consciously think about what you are doing, and if you are doing what you're setting out to do, and that you are addressing your research questions. Your research questions basically sort of frame everything you do, which is why it's very important to have those fleshed out. However, a benefit of a research question that also makes it different from a hypothesis is that you can freely change the research question over time based on what you're seeing in the field. This is different than a hypothesis, which by definition needs to be rigid. It must be basically a yes-no question. Is this what is happening in a given community? I'm not asking yes-no questions when I'm doing a research question. I'm primarily looking at the how, the what, the where, the when, and the why. And if I'm asking a question that doesn't seem relevant to a participant, there's no reason for me to keep asking that question. I can modify that research question and find something that is more adherent to the local context and is more responsive to what I'm seeing in the field. So, ethnography. You can sort of think of ethnography as both doing the actual fieldwork and also writing about it. That may seem just as a assembly to fieldwork, so let me explain. Participant observation, which I will refer to here as PO moving forward, basically is just hanging out in a given population for a long period of time so that you're more familiar with what is going on in terms of local cultural practices, unspoken behaviors and norms, and also so people can see you on a daily basis and get used to seeing you. Otherwise, you may just appear as a researcher in a lab coat, essentially, and that's going to influence how people think about you and how they respond to your questions. This is tied to naturally occurring conversations, or NOC. And NOC basically is me talking to people during observations. If I'm hanging out with guys in Belize trying to explore gender power relations, me asking them questions about, okay, why did you just catcall that woman, or why do you think that was acceptable, are part of the natural flow of me hanging out with them. I'm seeing something and I'm asking about it, basically. They may ask me questions, and that may lead to me asking further questions as well. And then this more formally is an interview. And there are different forms of interviews here. I primarily conduct semi-structured interviews, but it's probably best to first frame a structured interview first. So a structured interview is the one you probably are most familiar with. It is being asked a series of questions, and that script does not deviate. I will ask you this question, then this question, then this question, then this question. I will not ask any additional questions because that's not what I'm really trying to do. A structured interview really is trying to get a representative amount of data from a large group of people, for the most part. And any deviation from that can lead to, for instance, someone mentioning something that someone else doesn't because the question was not asked. That is a strength of a structured interview. It does not deviate, therefore it can be standardized. In somewhat contrast, a semi-structured interview primarily has that script of questions, but it allows itself to be responsive to what the participant is saying or any question you may think of on the fly as they are talking. As an example, if I'm asking the question, why do you not wear a condom? And the participant says, oh, I just really don't think that men need to wear condoms. I think it makes me feel less masculine if I do. I can ask a follow-up question, or a probe, as they're called. Oh, why do you think it makes you less masculine? And that understanding may be something very critical to me understanding my research question, or it may result in additional research questions that I would not have gotten if I had just asked a standardized script and didn't deviate from it. There are strengths and weaknesses of doing both of these things. Semi-structured interviews are very time-consuming, and you need to have enough data to really be able to say something. And it is easier to say something if you're just asking the same questions over and over again. This also leads to what kind of analyses you're going to do. When you collect all of that data, what are you doing with it? I can't just print out all of my interviews and say, here is my research. I need to find themes and commonalities and extrapolate what I'm seeing and explain what is going on here. There are two methods, basically, of that explanation that can be lumped into quantitative or qualitative analyses. Quantitative analyses you can think of as numbers and frequencies. How many people said this thing? That's at its basis the simplest explanation of what quantitative data is. It can be counted. For instance, if I'm getting demographic data and I'm having people check off, do they identify as a man or a woman? I can say at the end of my study, 30 participants identified as a woman and 28 identified as a man. I can count that. In somewhat contrast, you have qualitative analysis, and this looks for themes in interviews primarily, but also it is those conversations. I'm looking for themes in the data. I'm saying, okay, this is interesting. People are mentioning this. What does this mean? It's mainly there to explore the data, not just present it. Quantitative data presents information. X amount of people said Y. Qualitative says, people said this. What does this mean? And what does that mean in terms of my research questions also too? Qualitative research is very difficult to do. And because of that, quantitative minded researchers often feel very uncomfortable with qualitative data. It's too messy, basically. But on the inverse of that, qualitative researchers often say that quantitative data is oversimplistic. It boils down messy human behavior into ones and twos, essentially. And that also comes at a loss and is difficult to really make any claims that may be representative of a very complex issue, such as condom use practices in a country, for instance. And then there are others conducting what's called mixed methods research that incorporate both quantitative research and also qualitative research as well. Mixed methods is sort of a buzzword right now. You might have heard the term before, but there is this perception that is growing in research, different fields all over the place, that in order to have a better understanding of what's going on in a given context, you really should have both quantitative research and qualitative research complementing each other, give you a better picture or a better lens in which to view the world and your participants. Now I'm going to go through a few steps that really are the backbone of a good research project. And the sort of foundational step for that is to see what is out there. What have other researchers been doing on a given topic that is of interest to you? This is a literature review, and you've probably done a little bit of this in previous coursework or classwork, but doing this effectively and making sure that you have a good generalized understanding of what the scholarship is concerning your topic is a valuable skill to have. And also, it's not something that comes intuitively. It takes practice. And because of that, we're going to be having you practice how to conduct a literature review in your papers in this class later on in the semester. So prior to doing research, prior to conducting fieldwork, the first step you should do is to find academic literature and resources on your chosen topic. If you are researching food insecurity, for instance, it is important to know what has been done already so you have an idea of what to expect. Additionally, if you are interested in a topic, it is likely that there already is scholarship on that topic. So it behooves you basically to go out there and see what other people are doing. One additional reason to do this is because you may think you're coming up with a novel question that no one has answered, but that is largely due to people not having done a literature review. You need to do this so that you can find an area that you either want to expand upon or you think could be done better. You don't want to produce a research paper, for instance, and claim this is a novel finding that has never been found before, and then someone critiques your paper and cites a bunch of scholarship that says, hey, this has already been done, maybe even better than the way you did it, because they had a better grasp of what has already been done and the sort of history of that certain topic. A good method for framing your research questions is to find the questions asked in previous scholarship, additionally. So when you're When you're formulating a research question, if you're doing this the way that you really are supposed to, you are finding what the scholarship has done on a certain topic and try to find questions that you think are relevant to that topic. They may be questions that you can basically just copy paste and use yourself, or you may want to tweak them or refine them based on your project goals or needs. I have a link here also to the Centers for Disease Control and Prevention's sort of homepage for the Zika virus. This was very useful for me because it gave me a background on, for instance, the viral pathways of the disease, its health consequences, and also some of the ways that it could be spread. So for instance, Zika virus is a very unique disease in that it is both a sexually transmitted infection as well as a mosquito-borne disease. You can get it from a mosquito, you can get it during sex, and additionally you can get it through blood transfusions as well as passing it from a pregnant female to the fetus, so-called vertical transmission, which you also see in HIV. This is a good example because HIV has been long known to be able to be passed from the biological female to the fetus, and there's a ton of scholarship concerning reproductive health about the consequences of that sort of interaction at the biological level. So when I was doing my Zika virus research, really this was a novel disease. There wasn't a lot of scholarship on it when I was doing my own research. So I pointed out that there's not a lot of scholarship on Zika. And because of that, we need to be able to pull from other sources of information, including, for instance, dengue fever, another mosquito-borne disease primarily spread by the same mosquito species of Zika virus. So I could build my research based on the foundation of dengue fever research, for instance, despite there not being any articles or literature on the Zika virus, really. Additionally, I could pull from other infectious disease scholarships, such as HIV as an example, because of its ability to be transmitted sexually and also during pregnancy. So you can start to pull at the different threads of scholarship and find things that you think are relevant to your own topic, even if it's not readily apparent that this may be relevant to you. And the only way to really do that is to have an understanding of what is out there. And that way you're not grasping at straws. You have a foundation to sort of build upon when formulating your research project and also actually doing the research itself. This stage will also inform the questions you're going to ask in terms of doing an interview or a survey also too, because you can see what other scholars are asking and you can sort of start to formulate what you may want to ask as well. Building off of that previous slide, your literature review will often also inform what sort of theories or theory you might want to utilize in your research. For instance, if you're reading about food insecurity again, you will probably see the theory political economy of health, which argues that politics and economics intersect to create health disparities. For instance, when you're thinking about structural violence or structural racism, there's a history in the United States of so-called redlining, which is where development was largely favored at the policy level in communities that predominantly had white populations. What that means is basically grocery stores, public schools, infrastructure was favored in white communities to the detriment of communities of color that, for instance, are found in so-called food deserts, another concept and theory used in food studies that says in minority communities, there often is a disparity in the amount of healthy foods that are readily available. This leads to another theory that's developing called a food swamp. And a food swamp is different from a food desert because a food desert says there's no nutritious foods in a certain community or they're hard to access. A food swamp says because of that food desert, what often happens is there's a large amount of unhealthy food options, for instance, fast food in a given community. This is going to have an impact in terms of both the health of a community, but also economics. Because communities of color oftentimes also are, on average, poorer than white neighborhoods because of a history of racism and structural violence and structural racism throughout our history, which has shaped health potentials and economic potentials, and also economic mobility. For instance, the majority of service workers, fast food workers, are also persons of color. That's just in the history of our sort of capitalist system, which is based on, for instance, where someone grew up, the types of services they have available to them as they're growing up, the sort of education they have available for them, Are they able to go and pay for an expensive school? Are they able to travel to find work? Are they able to travel and go to the grocery store, for instance? The reason that food swamp is a good way of thinking about food insecurity and also the disparities, because if an individual, for instance, doesn't have a car or has to travel some distance to go to the grocery store, they may feel that it is easier for them, or they may feel they are trapped basically into eating fast foods or foods that don't have adequate nutrition or are cost effective basically. So this is why people say it's expensive being poor. It's not just, for instance, you having to worry about bills in the everyday, but also it can have a negative toll on your own health. From a public health perspective, creating context and environments where people are having to make sort of unhealthy or risky choices ends up also being economically detrimental at all scales of a given society. So in favoring certain communities, you actually are putting a bigger strain on the overall network of individuals, because people are not sedentary creatures. They travel a lot, for instance, to go to work, to go to school, as another example. So we can't think of communities as isolated entities of this is a white community and this is a black community. However, that often is how policy and structural sort of factors and ways of thinking about the world are kind of based upon. And that creates health dynamics and environments that are detrimental to the marginalized communities, particularly of color. And then when you bring in gender as an example, usually what we end up finding is that minority women of color are also at highest risk for a variety of different factors, including, for instance, being malnourished or experiencing obesity or diabetes compared to their, for instance, white counterparts. Because, again, of a history of racism, a history of economic favoring of certain communities of color, or different white communities over communities of color. I hope this makes sense, and it's complicated, and this is why it's important to have an idea and a good grasp of the scholarship, because all of these sort of factors are interplaying into each other. And if someone's reviewing your paper, or your research proposal, rather, also too, which I'm going to have you do also later on in this semester, they may be having questions. Okay, why didn't they talk about this? Why did they focus on this, and why is this ignored? That kind of thing. Another popular theory also is grounded theory. There are different kinds of grounded theory, including modified grounded theory, for instance. And this is a little different from a normal theory, because grounded theory basically just says, if you bring a theory into a topic, you may be inherently biasing that topic. So the theory should sort of come organically as you're doing research. This is hard to do, and it may seem counter to what I'm talking about. But basically what it is trying to say is that you should not try to walk into a given site and say, okay, I'm going to look at political economy of health. What you can do is see, okay, is what I'm seeing in line with that theoretical perspective. So basically collected theory and data informed the theory, which can be used for analysis. At the end of the day, we're just trying not to make any given assumptions, especially if we're using research questions and not hypotheses. Remember, hypotheses, you're making assumptions. You're saying, I think this is a variable that is affecting this. A research question, in contrast, says, what really is just happening here? And then what can you analyze that data with to explain what is happening there? And that's where really theory comes in. Now that we have started to go over the why it is important to develop research questions based on a literature review, let's start to formulate some questions. And if you would like, I would suggest you even maybe pause this presentation as I'm talking and sort of think about a topic of interest to you and some potential questions that you may want to answer or find answers to at the very least. And one way also of doing this, of course, is to conduct a literature review so you have an idea of what sort of questions are asked on a given topic that you maybe can extrapolate and use for your own purposes. So you can start with research questions. Just know that they're very adaptable. So it's important to approach the literature with an open mind, because you may end up wanting to change your question down the line or before you even start a project, which is totally fine. So let's look at my own thesis work and pull apart the research questions that I use to frame my project. Remember, a research question is not really something that you necessarily need to explicitly ask someone during an interview. They primarily are there to guide your research. What you can do is say, okay, does this interview question answer some aspect of my research question? Think of that always. A rule of thumb that I'm often told and have heard in classes is if you're asking a question that doesn't bear relevance to your research question, get rid of it. It doesn't really answer what you're trying to look for. So the three research questions that I operationalized for my thesis work were, what are the experiences of communities in Belize with Zika interventions? This is a very broad question. Basically, I'm asking, what are communities doing to address or respond to Zika virus? And that can include, for instance, vector control interventions. It could include individuals burning shrubbery and their property to ward away mosquitoes. It could be individuals trying to limit the amount of solid waste that is in their communities because mosquitoes like to lay their eggs or larvae as they develop in like garbage, as an example, in neighborhoods because it is in close proximity to humans that they can use as a source for blood to reproduce. And then I also have another question here, which is, to what extent do healthcare discourses and community preparedness initiatives shape perceptions of Zika-related health risk? What this question is asking is, okay, the first one is, what is being done? Question 2 is, what sort of policy discussions, media reports is the government of Belize producing? And how are these shaping perceptions of Zika virus? For instance, the Ministry of Health in Belize urged women to postpone pregnancy because of fears of contracting Zika and causing congenital abnormalities in the womb. How were women largely responding to that declaration that you should not get pregnant right now? Additionally, the Ministry of Health declared Zika in Kikaker Belize to be endemic. An endemic basically implies that a disease is there to stay. We're going to have to basically just deal with it until something happens, or it's just going to be part of everyday life that we have to get used to. How do individuals perceive that sort of understanding about the disease that entered the country for the very first time that we know of in a very short period of time becoming endemic? Basically, in a span of a few months, a disease that was never before seen in Belize was declared to be endemic in the community where I do research at. What does that mean, and how do individuals perceive the government's role in trying to reduce or prevent the spread of Zika virus? And this also ties into the last question, is how do different communities perceive Zika? The first two are looking at what is being done, how are people talking about it and thinking about it, and then the last question is, how do people actually perceive this virus called Zika? Anthropologists like to talk about infectious diseases as also a cultural construct as much as they are a biological reality. There's this thing called COVID-19 that is in our community, but we don't see it physically. You may see the health consequences of it, but diseases and viruses are largely invisible. And it's not until they are expressed somatically, so basically physically in the body, that we really can see them, and at least their after effects. But because we can't look at the cellular level, for instance, when we're looking at something, we don't really see Zika. We don't see COVID. It's just there. And it's going to have both biological consequences in terms of health and wellness, but also in terms of cultural understandings. For instance, think about when COVID-19 first became sort of an epidemic and a scare in the United States. People were buying up toilet paper, they were buying up hand sanitizer, they were emptying out stores of their food goods. That's a cultural consequence, and also a political economic consequence of a disease that is largely invisible. But we can see it expressed in reality through these different sort of cultural practices and behaviors that humans do. So these are the sorts of questions that you may want to sort of think about in terms of your own project, and think about the scale also too. In anthropology, we tend to look upwards. So for instance, like what is being done in policy, and then what impact does that have on the ground, as we call it. So how does a community member in a small island in Belize perceive the role of the government in preventing the spread of Zika and also talking about this disease in terms of you should be responsible for your own health? And that sort of public health discourse that anthropology also often critiques. And we'll get into that later on in this semester. So some things to consider. I already sort of mentioned number one, but just know that research questions aren't rigid, or at least they don't have to be rigid. If you see something in the literature during your literature review, or you see something in the field that you think is interesting, feel free to add a question or tweak a previous question. You may also find out that during the course of interviews, no one really is talking about, let's say, government discourses concerning Zika. So it may be an irrelevant research question to ask. So you can start to get rid of it or maybe refine it so that it is more relevant to community understandings and perceptions. Also see the sort of language that I'm using to frame these questions. I have what are the experiences, to what extent, and how do different communities perceive Zika? These are more open-ended questions. They're not asking yes/no questions. They are asking exploratory questions that get at a richer level of detail than, for instance, a survey question that gave you a multiple choice response would be able to answer. These are the hallmarks of a good research question, is them being open to interpretation, not just for yourself, but also for the individuals that you're doing research with. So they are open-ended. You're not making a hypothesis or a claim. I may have an hypothesis in my head. For instance, I could assume that because based on the literature, there's going to be economic disparity shaping who is at most risk for infectious diseases. It is well established that poor individuals are at highest risk for infectious diseases. I can have that assumption, but what I need to do is make sure that I'm not leading participants during interviews by saying, hey, you are poor. What does that mean about you having Zika? That may end up just coming up organically during the interview, but I'm trying not to have that bias basically inform my questions because I'm asking exploratory questions. I'm not trying to make assumptions. However, anthropologists also argue, and I also argue myself, that no matter what you do, you are bringing in your own inherent biases. It's really hard to take an applied or critical perspective towards a given health disparity and not start to think about, okay, what's the role of economics here? What's the role of gender and power here? And how are these shaping health potentials? You can ask those as research questions, of course, but if you're not asking these as research questions, you may be doing that implicitly without really thinking about it. So when you're reading an article, also think about, okay, what is the agenda of this piece? Everything has an agenda. Agenda doesn't necessarily mean always it's a bad thing either. If you are looking at a report trying to, for instance, address food insecurity, that's an agenda. You are trying to address food insecurity. Agenda has a negative connotation to it, but it doesn't necessarily have to be. And that is easier when you are more explicit with your theoretical perspective and also your underlying biases. This leads to your own positionality, which is another topic that we'll get into in this class, and you basically will write a positionality paper later on in the semester. But in summary, basically it's what are some factors that may be shaping your understanding of the world? What may bias your perspective? In my example, I am which I've said before, a white cisgendered male that is heterosexual, coming from a position of privilege as a PhD student in the anthropology department here at USF. And that's going to shape how people think about me when I go into the field. And also it may shape the sort of questions that I ask without me really thinking about it. It just happens naturally. And a good way to sort of get around that or to address it is to critically think about your biases and your positionality and also make them explicit so people know where you're sort of coming from also too. It's hard to do, but it's also very relevant to doing effective research. All right, so you've done your literature review. You've picked out some questions you may want to answer. Now think about where you want to do your work. Some people start with this, and that is a common pitfall. Come up with your research site once you have an idea of the extent of a certain problem you may have. That's what I would suggest. It makes things easier, and it may lead you to having a less biased research project also too. So after you have an idea of the questions you want to ask, you should identify where you want to do research, is what I just said. As an ethnographer, your field site, basically where you want to do work, also includes the people you expect to talk to. So try to find media sources or academic articles on your chosen community. For instance, if I wanted to look at Feeding Tampa Bay's role in addressing food insecurity in Tampa, there's a lot of scholarship by anthropologists and public health specialists that work closely with the organization that I can pull from to find out what's been done previously and also what is Feeding Tampa Bay currently doing to address food insecurity. For instance, some anthropology research was done in Key Cocker Belize prior to me going there. But anthropologists have also worked in the mainland extensively. So there was no reports looking at Zika virus in Belize because Zika virus was very new to Belize. So I had to sort of extrapolate and find alternative means of scholarship to sort of compare to what I was seeing. And that was very fruitful in my research by looking at malaria research and dengue fever research, among other mosquito-borne infectious diseases in the country, as well as infectious diseases including HIV, which is very prevalent in the country, to be able to have a good grasp of what I was going to do when I went into the field, the sort of questions I should ask, who I should talk to, that sort of thing. In terms of my own research, I talked to doctors, I talked to nurses, I talked to community health specialists, I talked to community members, I talked to vector control workers, I talked to restaurant owners, bar owners, basically everyone that has some role in the community, because everyone has a role in the community. And those different perspectives often can help you get a better picture of what's happening there. And you wouldn't really know that unless you either went to the field already and started to get a lay of the land, or you did a literature review or a review of local services, for instance, to be able to see, okay, what am I walking into? And who should I talk to? And how can I get them to introduce me to other people? This is a hard skill to operationalize, but it's also good practice to start to think about this when you are thinking about a certain research project also too. That being said, anthropology has a sort of built-in benefit, which is why we often do the long-term research, and that we have a lot of time to sort of explore local dynamics and find out, for instance, who we should talk to. The work is time-consuming, though, and you can't talk to everyone, especially since you will be doing a rapid assessment. And by doing, I mean when you're thinking about a problem you want to address in a paper in this class, you will have to look at the literature, you have to look at online resources and sort of do a quick and dirty analysis of who you should talk to. You want to actually talk to anybody in this class in terms of your intervention paper or your problem paper, but you will sort of think about, okay, if I were to talk to somebody, what would that look like? What's my target population? So you should have a few target groups you would want to observe or talk to. As I gave examples, I could talk to Key Cocker community members, residents and business owners. I could talk to healthcare specialists, doctors, nurses, pharmacists, and also vector control and waste management workers. These three categories, basically, I used my target populations when I was saying who I was going to talk to and what kind of information I was going to get. This is a good way of conceptualizing doing field work in anthropology and also just field work in general when you're doing research, because you need to be able to identify key individuals, key informants as they're also called sometimes, that can give you a better picture of the local realities that you want to really get an idea of when you're doing research. What I am talking about here is particularly relevant to participant observation, or PO for short. But your methodology basically are the things that you plan to do. You can define it as the methods that you will use to find answers for your topic of interest and explore your research questions. I had those 3 research questions on a previous slide that I mentioned. Now, how can I go about trying to find answers to that? That's the role of your methodology. Your methodology also should be informed by your theory, research questions, and what would be feasible given your field site and target population. To give an example, during my master's research, when I was formulating where I was going to go, I had proposed doing what's called a multi-sited ethnography. And that basically means I would go to at least 2 different field locations and do a comparison. So for instance, I wanted to go to the smaller island of Key Cocker that had endemic Zika, and then I wanted to go to the larger island of San Antonio to be able to compare these two islands, one with a lot more resources that wasn't declared endemic Zika, and one with very limited resources that had endemic Zika declared in their community. However, my master's thesis advisor said this is more like a dissertation project. Let's hone this down to make it more feasible for a master's research agenda, basically. So I decided on just doing Key Cocker, and that allowed me to have a richer level of detail in that community than if I had split my time basically in two different field sites. As a sort of refresher, ethnography basically is both doing fieldwork, going into the field doing research, as well as writing about it. And anthropology often uses three distinct methodologies to explore their research questions as part of doing an ethnography. And that's participant observation, basically just hanging out in a community and talking to people, which leads to naturally occurring conversations. So what are people talking about to me when we're discussing Zika virus, as an example, during our everyday conversations? And then interviews. And I've already gone over the difference between structured and semi-structured interviews. But just know that sometimes you may even want to do both also too, depending on what you're trying to find out. But your methodology basically should be informed by your literature review, the theories you're using, and also your research questions. Because remember, your research questions basically are always in the back of your mind when you're doing fieldwork, saying, okay, is this relevant to what I want to find out? That's really the crux of doing good research. To provide you a good working definition of participant observation, again, as a reminder, many anthropologists can't agree on anything really, but this is the one we're going to be using in this class. You can think of PO as a usually qualitative method in which a researcher takes a part in the daily activities, rituals, interactions, and events of a group of people to learn the explicit and tacit aspects of their routines and culture. This sort of has been building up throughout the semester, but basically what this is trying to say is that as an anthropologist, as a researcher doing PO, you are trying to get that local reality, that thick description I mentioned earlier. See, what do people do on a daily basis? Why do they do those things? Why do they not think about doing those things as a part of their everyday life? These sort of unspoken behaviors are really what PO is good for. You can observe something and ask questions about it. Oh, why'd you just do that? Why'd you just catcall that woman? That information could be useful for you and may make your participants start to reflect on and critically examine what they are doing in a way that they never maybe have done before because they were not possibly asked that question by a researcher. You can get very real, thick, organic data from participant observation. It's just very time-consuming, and it requires a lot of tact on the part of the anthropologist. You're not trying to offend anybody, but also you need to make sure that you are pressing them enough, like you're doing an interview, basically like a reporter as an example, to be able to get good answers also too. And there always is a risk that a participant is lying to you, either because they are trying to be malicious and maybe they don't like you, or potentially because they don't want to be embarrassed and say something they think that you don't want to hear as well. So you need to be able to read people, and that's also a very hard skill, and it requires a lot of time and patience and trial and error also too. It just occurred to me this may be your first time actually seeing well, at least half of my face. I'm wearing a mask here, and it's not because of COVID. It is because I am riding around with a vector control vehicle in Key Cocker Island. I say vector control vehicle, but really what it is a pickup truck that also serves as the island's dump truck. During the day, when they are not spraying for mosquitoes, they collect garbage on the island, and then they drive it to the dump site to be offloaded to the mainland via cargo barge. But when the local village council says, okay, you should go out and spray today, usually very early in the morning or closer to late at night, they will offload the garbage and onload in the bed of the truck a fumigation machine, which you can see spraying out the back of the truck here. My role in this was basically to be an observer. I was riding in the truck, I was asking questions as they were going around and fumigating. I was watching reactions from people that are in the community walking by the truck, oftentimes running away from the truck because they don't want to breathe in the fumes. And then I would ask, for instance, do you think this is an effective means of controlling mosquitoes to the vector control workers? And those sort of more organic conversations I was having while riding around with them gave me very rich data. As a small little anecdote, it's funny because the fumigation machine says highly flammable, do not smoke around this machine. We're sitting here on their smoke break, and basically this is trying to fumigate the surrounding area, but it's not very effective when you're sitting still like this because it's only getting really the area around it here. Also, what I found in the literature and also what the vector control workers were complaining about was because this is an island, very small island, and there's a lot of wind on this island. That means that basically the fumigation is basically just being carried wherever the wind is going. So how effective this really is, especially in the rural areas that are very open compared to the more urban areas, is up for debate. But people see the fumigation machine, they perceive it, so they think that something is being done. And those perceptions can go a long way in promoting community understandings and community willingness for there to be fumigating, basically. That being said, a lot of individuals are actively resisting the fumigation. So for instance, the Ministry of Health and vector control workers urge islanders to keep their doors and windows open when the fumigation machine is driving by, so that the fumigation can enter their homes. Because what ends up happening is if the area around a home is fumigated, mosquitoes will try to escape by flying indoors. So what ends up happening is if individuals close their windows and doors because they don't want to breathe in the fumigation, they may be increasing their risk for mosquitoes by having them basically trapped inside the house with them. Also, another anecdote and why observation requires a lot of time and patience is that this truck also does not have air conditioning, and it's a very hot island. So you can either bake yourselves in a vehicle for up to 4 hours without AC with the windows up, or you can roll the windows down, which sounds great, right? You get that island breeze. However, again, using that same principle of fumigating the environment but not the inside, if the windows are open inside of a truck, when you are driving into hotbeds of mosquito breeding, the mosquitoes are trying to escape inside of the truck. So to combat that, we basically had rags that we were using to sort of beat the mosquitoes away, and that's really all we could do. You can only mosquito repellents basically just reduces the amount of mosquitoes that are biting you. They don't necessarily prevent all mosquito bites, which I'm sure you know as a Florida resident at this point. If you've ever been to camping, for instance. So what ends up happening is you end up getting highly exposed to getting bit by mosquitoes, which may increase your risk of developing mosquito-borne disease, despite being in a truck that is designed to try and reduce the amount of mosquitoes that are in a given population. So the vector control workers themselves are exposing themselves to a high degree for potentially getting infected by a mosquito-borne disease. That really was a complaint for them also too, and last time I was in the country, they now had a new truck that had air conditioning because of the responses they were getting, and because I, from my position of privilege, went to the village council and basically explained their complaints, and those two things helped sort of justify the need for a truck. That's sort of the applied role you can take when you're finding disparities in a given community also too. So PO can really be split into its two root words. There's observation, which is watching behavior, writing notes about it. For humans, this can include overhearing conversations and watching people do something. For instance, I was talking to someone about littering on the island, which they told me was a problem, and then as they finished their drink, they threw the bottle on the ground. I observed that behavior that went against what they were just talking about. Then there's participation, which is doing what people in your study are doing. Having naturally occurring conversations help them with tasks, be a member of their community for a time. So if I'm hanging out with guys in Key Cocker, I may be just socializing with them, asking questions, sort of being their friend for a time, and just kind of hanging out with them, essentially. And that can lead to a more trusting relationship and rapport between you and your interviewees or your community members that you're trying to research with. Also, a very important part in anthropology is let people know that you are doing research if you're talking to them. It is unethical to an anthropologist to not let your researchers know, your interviewees or your participants know that you are observing them. Some disciplines like psychology, for instance, or sociology are more okay with you being subversive or maybe even lying to participants. But anthropologists consider that to be unethical, so they are very upfront with the fact that they are doing research. For instance, when I would approach somebody, I would say, "Hi, I am a master's student in the Department of Anthropology at USF, and I am doing a research project on the Zika virus on the island. Would it be okay if I spoke with you?" Being very upfront about doing your research also allows people to be keyed in on, okay, I don't want to talk to this guy, or hey, this is interesting, I should probably talk with him to see if I can help him out, basically. Sometimes this prevents you from getting your foot in the door, but that's okay, because not everyone wants to talk to you. Not everyone needs to talk to you either. It's up to them if they want to or not. That being said, if it's in a public space, you also have the potential of having a more open means of observing people that you don't necessarily need to get consent with. If I'm sitting in a coffee shop watching people's behavior, I don't need to walk to each single person and say, hey, do you mind if I watch you? Hey, do you mind if I watch you? It's just a public space that you're allowed to sort of watch behaviors with. You probably have people watched with a friend before in a restaurant. That's basically what you're doing here. That's not unethical necessarily. However, when you're doing observations and research, it is very jarring or off-putting to participants sometimes when you pull out a notebook as they're talking. They may feel that, okay, he's writing something down, this is important. Why didn't he just write something down when I talked just then? So what is a rule of thumb is, within reason, try to write out of sight of individuals. That way, the notebook in your writing doesn't sort of bias people's communications with you. Again, a hard skill to have, and it is generally recommended that you immediately sort of word dump as much as possible as soon as you're done talking to somebody, because you can very easily and very quickly lose that very valuable information when you spend too much time without writing down notes. All right, now I'm going to give an example of a semi-structured interview that I think gives you a good sort of understanding of how this process works. So as I'm writing these questions, I have a question in mind. So I have question 1 here. And then I additionally have probes, which may be follow-up questions to that question that I can write down. Additionally, you can probe on something that someone says that's not written down. So if they're asking, or again, if I'm asking them about condom use practices and they bring up, oh, I think it makes you less of a man when I wear a condom, you can say, oh, why do you think that? That's not something I wrote down on the questionnaire in particular. It's just something that I thought would be an interesting question or relevant question to what they just said. That also helps you sort of let the participant know that you are paying attention also too. But let's go through this example. So I have question 1. Can you tell me a little about how long you've lived in this community? Very broad question. You may get a sentence, you may get multiple paragraphs. Some people are talkers and some people aren't. But it's good to have sort of transition words in here like, oh, that's good to know. Would you say it's changed a lot since you were younger? So if I'm talking to, let's say, an older individual that's lived in Tampa Bay all their life, they probably have a very different understanding of what it means to be a Tampa resident. So for instance, oh, I noticed that there used to be a bunch of restaurants here, but now it's getting gentrified, and a lot of the mom and pop shops are leaving, and now it's just one big chain restaurant or one big chain grocery store. You wouldn't be able to get that unless you talk to someone that was a member of the community that's been there for a long time. Which can lead you to your next question is, oh, why do you think it has or hasn't changed much? So if they say, oh, it's been about the same, you can say, oh, that's interesting. Why do you think it's been about the same? Or if it's been very different, why do you think it's been very different? These sort of probing questions based on your initial question can get you that richer level of detail that you can't really get from a structured interview that only would basically ask the first question. That being said, as I mentioned before, these are very time intensive and people love to talk, so you need to be able to steer them back on track basically if they deviate too much. If you get a talker that's talking about something very irrelevant seemingly to the conversation, let's say you're bringing up condom use practices, but they start talking about how they needed to walk their dog the other day, you say, oh, that's interesting, but just to make sure that we're staying on track, do you mind if we steer this back a little closer to the conversation? That way, people are not offended. So you have to be able to sort of mediate and be able to get them back on track without being rude about it, basically, or at least being perceived to be rude about it. Again, a hard skill to do. Because you're having to dynamically respond to participants, it is much more difficult than structured interviews, but also it is richer, as I'm trying to say. You can get multiple pages of data on an interview that only has a few questions, compared to, let's say, a structured interview that has the same amount of questions, but you may only have a page of data. So you get a lot more information that potentially is useful for you from a semi-structured interview than you potentially would get from a structured interview. But again, there's caveats to doing either or. Time-intensive but richer data basically is how I would describe the positive and negative aspect of doing this sort of interview. So a few more slides, I promise again. Now let's talk about a research instrument. This really is the thing that is allowing or facilitating you to be able to collect data. For instance, if you're doing observations, you often need a notebook. And an anthropologist that works, let's say, in a tropical environment may need to find a specialized notebook. So for instance, I will carry around a waterproof notebook that has special pens and pencils that allow me to write on it without it smudging when it rains, as an example. Additionally, a voice recorder is very important if your interviewees are comfortable with them being recorded. In my example in Belize, people are often very uncomfortable with being audio recorded because they are afraid that, for instance, it might go back to the government or the Ministry of Health. So the majority of my interviews are handwritten. So you have to be very good at shorthand and also making sure participants see that you're paying attention to them. It is very easy to bury your nose in a notebook when they're talking and just scribble away. That may, again, bias the interview because they may feel that you're being rude to them, you're only there to collect data, or that what they are saying is important to you in this context, but let's say I don't write when they're talking about something else, they may think that I don't think that's important to them, or important to my own research, which again can bias the information you're getting from the participant. So you are recording your field data in a notebook usually. You may be recording it audio or using audio software. But if you're doing that, you also need to transcribe it back to a written format or a textual format so that you can conduct analysis. There are certain softwares that allow you to transcribe, but you always need to double check by hand to make sure that something wasn't lost or something didn't get picked up during the transcription process. So it is very time consuming basically to collect data and also to transcribe it onto a computer, but a very important and necessary step. This also leads to analysis software. Let's say I am doing a quantitative project where I need to see the frequency of how many times a certain individual said a certain thing in a community. I will need analysis software to be able to basically crunch the numbers and find ratios, odds ratios, be able to quantify how many times someone said this certain word. And there are different programs for this. The most common ones are SPSS, which is from IBM. And SPSS basically allows you to analyze data from a variety of different formula, basically. And additionally, I was doing GIS, or Geographic Information Systems research, so I had to find mapping software to use. The most common one, again, is ArcMap from Esri, and that allows me to visualize my data and sort of extrapolate and run formulae based on the data that I collect. And then in qualitative research, there also are qualitative analysis softwares. So for instance, there's Qualitrix. But I'm kind of old school with my data analysis, and I do most things through thematic coding basically by hand, where I look for themes and sub-themes in my data collection process. So basically, I just need a Word document for that. Again, time-consuming though. So taking all of these steps into consideration, you would come up with a budget, another important concept that you need to think about, and find a grant agency usually to be able to fund your project. This is where a research proposal comes into play. I will be having you write a research proposal in this class at the end of the semester. You don't need to worry about a budget too much. Actually, I'm just going to give you a budget number. So you don't need to, for instance, sort of quantify how much do I need to spend on a certain topic. It'll just be done for you, essentially. But also know this is something that is very important. People that are reviewing your research proposal need to know that this is a feasible project and you have thought about all the steps involved to be able to conduct that research effectively. And that basically is it in terms of a research instrument. It's very context dependent and depends on what you're trying to accomplish and what kind of data you need also too. Now that you've done all of those steps, you've done your literature review, you formulated your questions, you formulated your methodology, you know where you want to go, you know who you want to talk to, you know how to collect data and analyze it, you are now ready to actually do research. Sometimes, however, you need to sort of make snap decisions based on what you are seeing in the field that may make you uncomfortable. Remember, for instance, I mentioned the example of me being uncomfortable seeing catcalling in Key Cocker among participants that were males talking to women on the island. How do you interpret your role as an anthropologist in that circumstance? Different disciplines have different answers to that because they have different ethical codes that they adhere to. So I'm going to give you one more slide, and that is the Anthropological Code of Ethics, where the American Anthropological Association's membership, basically. As a member of the AAA, I need to adhere to these ethical codes at all times. But you also see they're kind of vague, and that's because it is reflecting on the fact that humans are very messy creatures to research with. So you need to have that space for ambiguity that something like public health or sociology or psychology has more black and white and a lot longer ethical codes because they have more standardized procedures into how to do things. I'm going to kind of rapid fire this, but if you want to explore this topic further, the AAA Code of Ethics, which I have here on the slide, will give you an overview of the ethical domains that anthropologists sort of operate within. So there's do no harm, which is pretty straightforward. Basically, you are not trying to harm participants when you are doing research. You are trying to collect data with as minimum risk, basically we call it, as possible, or potentially even just to do good, which is a move in anthropology to try and leave some impactful change in a community through applied work, as an example. Then there is being open and honest regarding your work, which I mentioned earlier. In anthropology, at least the AAA Code of Ethics, we are not supposed to lie to participants about the work we are doing. You must say, hey, I'm a researcher doing this topic, and I'm walking around in your community, that kind of thing. You need to be open about it, and you can't be subversive and lie about your intentions. This is tied to number 3, obtaining informed consent and necessary permissions. Oftentimes when you're doing an interview, you need to show participants a consent form that clearly explains the research project and lets them know that at any point of the research project they can drop out or have their data be basically expunged from your report. That way they know this is voluntary and it's not something they have to do. Additionally, you can get informed consent a variety of different ways. Anthropologists are generally okay with informed consent via verbal consent. So like, for instance, if I'm asking, do you mind if I talk to you about Zika virus? To an anthropologist, that generally is okay in concerning being able to get informed consent. While some disciplines require you to have a physical informed consent document that must be signed by the participant. That often happens in anthropology too, but we also are more comfortable with verbal consent as well, which some disciplines are not. Then we need to also weigh competing ethical obligations due collaborators and affected parties. Think again of my example of catcalling. I had to weigh the ethical obligations of me as a researcher because the men that I was seeing catcalling were my participants, not the tourists I was seeing on the island. So I may end up doing harm by intervening on the circumstance to my participants, who are those that I need to in particular, value their health and wellness and also social status in the community. Additionally, if you're working for, let's say, an organization like National Geographic, you need to also weigh the mandates of what they are paying you to do in terms of a grant, with also being a anthropologist that may have ethical codes that may sometimes come in conflict with that of the organization that you're working for. This especially is hard to do in applied anthropology work where you're not working in academic settings, and let's say you work for GM or Walmart as an example. And there are a lot of anthropologists working in sort of corporate fields that have to sort of weigh the ethical guidelines of being an anthropologist also with being a worker of a corporation as an example. Additionally, there's been a move to make your results more accessible. So, for instance, providing reports to participants, giving them maps that you make based on your data collected, so that they have something tangible when you leave the field, and they don't get the perception that you were just there to research them and then leave. Does that make sense? If not, let me know. That's sort of been a push in anthropology, basically, especially in more recent times. Additionally, these two other aspects are less important to you right now, but they're important if you want to do actual research. And that's you need to protect and preserve your records. If I have a notebook that is talking about all the dirty secrets on the island, I shouldn't show that to other people because it may out someone for, let's say, doing a legal activity, or they may, for instance, see an example of someone talking bad about another person, which can then do harm in that community. So oftentimes we tell review boards that we have our information in a locked safe or it's behind a password protected computer as ways to sort of alleviate that concern. And then finally, we have maintain respectful and ethical professional relationships. Basically, all this says is that if you are talking to participants, you are a researcher as much as you are a human being, right? But sometimes one of those aspects of your positionality takes precedent over the other. You can be friends with participants, but also remember that you are a researcher, and you need to have some level of objectivity, or you may start to blur the lines in your data analysis, and it may end up becoming biased, as an example. There are also examples of anthropologists, for instance, marrying members of a given community they are doing research on, which is complicated in a gray area also too. But just know that there are certain boundaries that some anthropologists are more okay with stepping over than others. That may, for instance, be participating in illegal activities, participating in behaviors you find problematic. Anthropology is messy because humans are messy, and that largely is the moral of this whole presentation.